Hi, my name's Greg Fell. I'm Director of Public Health for Sheffield. This is a situation and epidemiology report dated the 25th of October, a half-term update. Firstly, then, epidemiology. Going up everywhere slowly, I guess, is the short answer to the question. Probably at a cruising altitude of about 400 to 420,000 cases per 100,000 over 7 days. Um, Mostly in secondary school age, but by no means all. Some say the rate of increase is settling. I think that's a very, very, very optimistic interpretation, and I don't subscribe to it. I think it will go up for a good bit longer yet, actually. Hope I'm wrong on that one. Almost all children. So almost all of our cases, secondary school age children. Not all by a stretch, but just significant majority are almost all children. And I guess expected. The mixing pattern is as per the pre-pandemic, and not a very well vaccinated group yet. That's changing. We're going as fast as we can on that one. Certainly not seeing a fall in the case rate in children. There are still plenty of susceptible children out there, so it's important that when you get your opportunity to be vaccinated, then you take that up. Some upward age transmission into parent age and a little bit of stacking upwards further. So a gentle rise, and waning immunity is the other watchword of the week. The rise in older adults is the time between now and when people had their vaccination. So some people now had their vaccination 10 months ago, and whilst the effectiveness of the vaccine has played out in a way hugely more positive than I'd dared hope for, waning immunity is actually playing out more negatively than I had hoped for as well. We are seeing waning immunity, and the over 60s that translates into infections, and it will also translate into some severe illness, sadly. So the over 60s now are the highest rates since January, and as I say, waning immunity is a concern in that one. Pretty decent immunity in middle age and younger adults because the time from when they were vaccinated and not as of yet much immunity in school age children. Numbers in hospitals are beginning to tick up slowly. Even a modest rise will have a disproportionate impact. I guess you could say the NHS and social care is in the depths of winter phase, but in the endish of October. So lots of respiratory stuff hitting emergency departments pretty hard now. Not COVID actually, and not flu. It's other things: respiratory syncytial virus, parainfluenza. Those things are hitting actually, and that's a surprise. So we're expecting continued pressure on NHS and social care for some time to come, actually. And obviously, we're not yet in flu season. Flu will exacerbate that. Message to all: get your flu jab, because that does make a difference. Most of the hospitalizations are in the most clinically vulnerable, and a significant number of hospitalizations for COVID are in the non-vaccinated. So, message: if you haven't yet been vaccinated, please do so. Lots ask me, will Christmas be cancelled? Too early to tell. Way, 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 way too early to tell. But the situation is blackening a little bit actually, and I think will blacken for some time to come. So then on to the second bit. Why is this going on? In short, immunity in the large, waning immunity. We started our vaccination program much, much, much earlier than lots of the rest of Europe, and waning immunity is a thing. Probably more likely to explain what's going on more so than other things, though other things are also in the mix. Masks is definitely in the mix. More indoor mixing, more large gatherings are in the mix. But waning immunity is perhaps the thing to watch most for. All that said, the proportion of people never wearing masks has rocketed in the UK, stays low everywhere else. We've largely stopped wearing masks. Masks have made a difference. I still wear mine. I hope lots of other people do, but I know lots don't. So they have made a difference. And large gatherings, again, have been an issue, and is contributing to transmission. And some broadly, the mood music is it's all okay. People thus behave as if it's all over. It's definitely not over. Ask anyone who works in NHS and social care settings; they will tell you it is not all over. Case rates are really high. Serious illness is way higher than we would want it to be, and that is going to create a very, very difficult autumn and winter for lots and lots of people. So those are the principal reasons why this is going on, and there are plenty of erudite explanations on social media. The best one I saw recently was a John Byrne Murdoch series of tweets explaining the why this is happening. Plan B. Everyone's asking me, when will Plan B be implemented? I don't know. It's not my call. It's the Prime Minister's call, as if and when to implement Plan B. It's probably more likely than not, but that's me guessing. I genuinely don't know. Plan B is a strategic document, a rather light on tactical detail. If nothing else, it's a significant way of shifting the narrative. The bottom line is COVID isn't over. We all want it to be over, but it's not over. We do want to get back to normal, me included. But COVID is still out there, as many of us know. My sense is it's a matter of time, but I don't know. I genuinely don't know the when. What we'll be aiming for is to sort of shift public behaviour so that remember the rate of growth of something. If it's currently it's above 1, and we need to get it to back below 1. And there's a pretty large level of residual immunity, so I think there's not going to be a spike upwards, but equally there's the getting R below 1 will be coming from a very high rate to something much lower, probably over a long period of time. What measures will be in Plan B? Again, guess, but if I had to guess, I would say face mask use, and we would encourage everybody to wear a face mask in enclosed indoor public spaces. By itself, it isn't going to be the thing that makes a difference, but it will make a difference, but it won't be the thing. But encourage all to wear face masks in enclosed public spaces. Probably the thing that will have the biggest impact is reducing contact. If you can work from home, do work from home, except there are lots of people who can't work from home, but if you can do, and that reduces contact. Vaccination passports may or may not be in, and I genuinely don't know that. Current government view, as I understand, against vaccine passports. Don't know where we'll go on that one. But the most important thing is continuing to get vaccination. As I say, the thing that worries me most is waning immunity, and in priority order. If you haven't yet had dose 1 or 2, then that's by far the most important thing. And booster jabs, as and when you're invited, and we're going through that one as quickly as we can, would be the second trigger. So then finally, what can we do? Whether or not we avoid Plan B is in our own hands, actually. There's plenty that we can do, masks, boosters, vaccination programs, etc. So there's plenty that we can do, but we all need to do it. Just me wearing a mask in a public space is not going to make the difference epidemiologically, clearly. So something about everyone does their bit. So waning immunity, as I say, particularly in the elderly and or those that were vaccinated first, is a worry. So be careful. If you are in one of those age groups, if you haven't yet had dose 1 and 2, it's 1, never too late, and 2, I would encourage you strongly to reconsider your choice in that space. Flu jabs will make a difference. It remains to be seen how much of a difference, but every year flu jabs always make a difference, and I'd encourage everyone to get a flu jab. Wearing masks indoors has never been a bad thing. We've all stopped doing it. You look around in any public place and there's less than 10% of people wearing a mask these days. So it's never been a bad thing, and I encourage you all to do it. And work from home if you can. Reduce your contacts with other people. Every contact is a potential opportunity for a virus to spread. That's how viruses spread, through populations. So reduce contacts as and where possible. All of the usual stuff is still in play. You've heard me drone on about it again and again and again. If you have symptoms, stay at home, take a test, act accordingly on the results of the test. That's the most important thing by miles and miles and miles. Hand hygiene has made a massive difference. It isn't by the thing by itself that's the panacea, but it does make a difference. Ventilation indoors, open the doors, open the windows. All of those things make a difference. It gets a bit harder as it gets a bit colder, but the basics remain the basics of transmission. Lastly, and I'll reinforce the point again, boosters. I can't stress how important it is that you have your booster as and when you're invited, and we're working through that in the same order as we worked through the initial vaccination program all those months ago now. I can't underscore how important that is, and that will be one of the things that makes a difference into the coming autumn and winter.